We will discuss about scapula, and here is the right sided scapula. How we determine this side? Because the glenoid cavity which faces laterally. So if we bring these anatomical points, this will face laterally and this will face the forwards, almost forwards. So the parts of the scapula has basically a body and three processes are: this is called spinous process, this is acromion process, and this is called the coracoid process. And the body has two surfaces, this is called the dorsal surface and this is called the costal surfaces, and it is almost triangular. In its costal surface, it gives attachment to the suprascapularis muscle, except it near the neck, because here a bursa present which is called the subscapular bursa, and in it along its medial border a muscle is attached which is called the serratus anterior muscle. In its dorsal surface, it is divided into two parts by spinous process, and the two parts are the supraspinous fossa and infraspinous fossa. And in its supraspinous fossa, the supraspinatus muscle is attached, and in infraspinous part, the infraspinatus muscle are attached. In its lateral border, teres minor muscle is attached, and it is interrupted by a artery which is called the circumflex scapular artery. And then lower part, teres major muscle is attached. In its lower ankle, its muscle is attached which is called the latissimus dorsi muscle, and its in its medial border, here the levator scapulae muscle is inserted, and here the rhomboideus minor muscle is inserted, and the remaining part are attached by the rhomboideus major. This is called the spinous process. It has two lips, upper lip and lower lip. Upper lips gives origin to the trapezius muscle, and lower lips gives origin to the deltoid muscle. In acromion process, the medial border gives insertion to the trapezius muscle, and the medial border gives origin to the deltoid muscle. This is called suprascapular notch. This is converted into suprascapular foramen by a ligament called suprascapular ligament, and above the ligament the suprascapular artery passes, and below the ligament suprascapular nerve passes. Now the ankles of scapula. This is called the superior angle, this is the inferior angle, and this is called the lateral angle. In lateral angle, here presents the glenoid cavity. Glenoid labrum is attached in glenoid cavity, and the head of the humerus attached with glenoid cavity and form the shoulder joint. And three ligaments are coracoacromial ligament, coracoclavicular ligament, and coracohumeral ligament. So thank you for watching this video, and like this video and share this video and subscribe my channel.